Hello everyone, happy afternoon or very good afternoon. I hope and I believe all of you are doing well. A quick note whether the audio visual is all good. Just let me check the live chat. Yes, I hope I'm audible and visible, everyone. All right, that's great. So here we are discussing all 200 questions authentic recall. So that is what I would help you with. And this is not to make you feel bad again, so you made so many silly mistakes. Let me tell you, everybody has. Like the first reaction post exam was the exam was very easy, but then there were a few questions which were tricky. The options were tricky. So that is what we are going to discuss. Why? Because I know that majority of you might appear for the upcoming NICT exam as well. So it's always better to know the answers to the questions that have been asked in the recent exam, or to know the topics at least that have been asked in the recent exam, because we also saw quite a few questions and topics being asked from NICT November 22 in the recent NEET PG exam. So don't worry about the mistakes that you have done. It's done and dusted. This is something that you cannot change. But with this 200 questions recall, I hope at least you would get a fair idea that what score can you expect. And I hope everybody would be honest enough to let us know. The Unacademy has also come up with the rank predictors, so all of you can put your scores there and get your estimated ranks as well. है So seems like the cutoff might go higher this time. This is what I feel as compared to the last year. The cutoff might go high. Yes, INICT is on 7th May, so we have 2 months for that. But let's take a chill pill now and let's quickly go into the recall. So I have done all my homework. I might seem a bit sleep deprived because I worked really hard on this, getting all the 200 questions can recall. And I have been a personality of that sort. Post exam, the first thing that I would like to do is get the recall of all the questions. Until then, I don't get that peace of mind. So I am a person of that sort. I know that there are two groups of people. One group would be like, now it's done and dusted, we don't want to look into it. But I'm on the other side who feels that let me know, what were the questions and what were the answers to that. I will definitely share the PDF of the 200 questions with all of you. But why am I doing this discussion now is because there are few questions, or quite a few questions where even I'm not pretty sure of the answers. So I would need your help in that so that we can make this recall more reliable, right? I remember the questions. I need your help in, getting to the right answer there. So let's start with the discussion here, everyone. And I'll share the PDF on the Telegram group. Right, this is the Telegram group. You can search for @Dr.Nikita. I will be uploading the PDF on the Telegram group. Okay. All right. So let's start discussing the first one, the histo slide. Yes. Anybody, if you have any doubts or this seems controversial, please let me know so that those questions we will keep it in the controversial questions wala thing, so that at least we are sure of the answers that we are very much definite about. Okay. So first one, everybody agrees to this? Yeah, there are quite a few controversial questions, I believe. So we will. It's better कि हम उसको wrong में count करके चलेंगे. So that when we get better scores than expected on the result day, we feel happy. We don't overestimate our scores. So please let me know wherever you feel that it's a controversial question. Okay. So first one, the histo slide was glomerulus. Everybody agrees to that? I hope all of you are able to see this. If not, I'll just zoom in a bit. Okay. So first one, the histo slide that was given, whether it was glomerulus, islets of Langerhans, it was Leydig cells, and it was glomerulus, right? Agreed? Just keep giving on a quick thumbs up so that I know that all of you are agreeing to that. Next question was that graph of the nerve action potential that was given, right? And B to E was marked, and it was given that B to E is the refractory period. Everybody agrees to that as well? I will again and again I'm reiterating, I'll provide the PDF so that you guys can calculate your scores. First, let's discuss the answers, come to a consensus, put the controversial questions aside. Okay? So, and when you're putting a thumbs up, you need to put just the question number also you see in the first column, so that I know that what is the thumbs up for. Is it still for the first one or the second one, so that I know for that as well. Okay, so the second one is B to E was the refractory period. Third one, dialysis disequilibrium, where history was just given. I think irrelevant history कि potassium बढ़ जाएगा, ये हो जाएगा. So in that case, mannitol is the answer for dialysis disequilibrium. Okay, mannitol is the answer for dialysis disequilibrium. Next, there was the clinical scenario given again with spasticity, people in a village using people in the village using stick. And it was Lathyrism ka history, and the question was, what vitamin will you give for prophylaxis? It is going to be vitamin C. It is going to be vitamin C. There is some query coming for second question, the nerve action potential. How many of you think that it's a bit controversial? कि यहाँ पे जो F point था, उसके बाद एक ग्राफ ऊपर जा रहा था, that is the point where it starts becoming hyper excitable. It is still the phase of hyperpolarization. It is more negative as compared to normal. So it is not becoming hyper excitable. So let's go with B to E refractory period wala answer. Next one. F was more excitable. So let's do one thing. इस वाले को फिलहाल मैं इसको डाल दूंगी controversial में, so that we are on the safe side. Right, so that putting more questions, as I say, in controversial or is better than over calculating. Okay? Next one. Epidemiological study, retrospective cohort study it was, because we were dividing into the exposure and then we were seeing ki case kya hai. It was not the other one out. Right? So it is retrospective cohort study. Next one, the tap water collection for bacteriological testing. What was the correct option there? The correct option was allow the water to pass for some time, some minutes before you collect the sample. The bottle should not touch the tap, right? The splashing should not be there. All of that. So fifth, sixth is allow the water to pass for some time. Right? That is the correct one. Then there was another question where the question was a patient hai, jiska now the patient is not needing near glasses, but the distant vision has become poor. What was the answer to that? Saint Arseno, there were two questions on lathyrism basically. One was vitamin C prophylaxis and one was the BOAA. There are two different questions. Yes, it is 1 minute. We will still go with that. It is allow for 1 minute before you collect. Okay, it's the answer there. Next one, index myopia. This is a feature of index myopia where the near glasses, the near vision rather becomes better, right? So that is index myopia. Okay. Next one, what was the answer to that? The image of a child, the eye ka image, right? The white eye, jaisa kuch diya tha, that was congenital glaucoma. Congenital glaucoma, right? Next one, bite. Bite, किसी का bite है और फिर lot of bleeding का history था. That was viper. Next, nasopharynx का image based question. That endoscopy image, that was fossa of Rosenmüller. Next, we had subarachnoid hemorrhage patient. Blood pressure given was 160 by 100. What would you do next? The next would be not a nimodipine. The answer there would be CT angio. Okay, the answer there would be CT angio. We need to control the blood pressure when it goes about 200 systolic blood pressure. Here it was 160 by 100. Right, SAH was directly given. So the answer there would be CT angio is the answer there. Okay, CT angio is the answer there. Next one, a confusing option wala question where ARBs ka various was given ki clearance is affected in hepatic insufficiency, renal insufficiency, right? Losartan, telmisartan. The true statement is what was asked, which of the following is true? So it is losartan is thromboxane A2 antagonist. Okay, thromboxane A2 antagonist. Eustachian tube opening is a bit aage wala, right? That was fossa of Rosenmuller is what I believe. That was fossa of Rosenmuller. Losartan is thromboxane A2 antagonist is what is the answer. Okay. Next one, what do we have is the histopath image of the heart with a lot of cells which were given. It was a history of a child, a 5-year-old child with fever and many other features were there, right? So this is more likely it is going to be, the answer is going to be the rheumatic fever. Okay, the answer is going to be rheumatic fever. Next one, a diabetic patient presenting with like sudden onset buttock pain, not able to sit since 24 hours. And we are seeing the black necrotic tissue reaching till the fascia and deep as well, right? So that is going to be necrotizing fasciitis, not gas gangrene because no history of crepitus was given. So necrotizing fasciitis. Acha, so should I put this one in the controversial one, whether it is rheumatic or it is lymphocytic? Because a lot of lymphocytes जैसे दिख रहे थे, but the history of a child with fever goes more in favor of rheumatic. So, but if there's a confusion, let's put it in the controversial question. Okay, I'll put it into controversial. ठीक है? ठीक है. Next one, trophic ulcer image-based question, right? A deep, very deep ulcer that was given. That was trophic ulcer. Another question of clean wound. The question said it was clean wound. And then there's a history of TT dose. That was 10 years back. What should be done now? It's a single dose of TT now. Okay, it's a single dose of TT that should be given now. No immunoglobulin. Okay, no immunoglobulin. Yeah. Okay. Next one, a different question. SPAD protocol specifically was asked in a child with severe dehydration was mentioned. Glucose levels were high. There was ketone bodies. The pH was low. That means diabetic ketoacidosis was there. And that is why, according to the SPAD protocol, the insulin should be started 1 hour later. And that should be the answer. So, jo bhi option mein, there were options which said that insulin should be started with the fluid. There was one option which said that insulin should be started 1 hour later. So that is going to be 1 hour later wala jo option hai, that is going to be correct there. Okay, that is going to be correct. According to the SPAD protocol, in the resuscitation phase, it is 20 ml per kg. Uske baad, then it is 10 to 20 ml per kg. 10 to 20 ml is what is given. I believe there was one option only which said ki 1 hour later wala sirf ek hi option tha. Were there two options which said both? That is insulin 1 hour later, or there were the rest of the options which said that ki ek mein tha ki insulin nahi dena hai, baki do mein tha ki insulin saath mein hi dena hai. Right. So that is the answer there. Insulin 1 hour later wala basically is the answer. Next question, CA cervix involving the parametrium going till the pelvic wall. What treatment will we give? What treatment will we give for that? Two options say. So this again 10 ml to 20 ml both is given. So I don't know the exact answer there. Your pediatrics faculty would be a better one there. So I'll put this also as a star mark to get to the right answer. If anybody of you get that, please let me know. This is going to be CTRT. Then previous twin, a pregnant female now comes and history of previous twin delivery 4 years back. What is it? It is okay. It is G2P1. Okay, it is G2P1. Next one, ectopic pregnancy ka patient, HCG levels 2800 were given. The size of the ectopic was also given. Basically, there were options related to methotrexate and salpingectomy. Okay? So it is going to be methotrexate single injection. It is going to be methotrexate single injection, not the option with leucovorin. leucovorin is not given when we are giving for ectopic pregnancy. Okay, when we are discussing ectopic pregnancy. Okay. All right, so it's better to put such questions into controversy. Don't get into the dispatch protocol questions. Usko controversy mein rakh do. Next one, the question on a female jiska symphysial fundal height was given 41 centimeters. Movements are there, but the fetal hack sound is not heard well. The parts are not felt well. So basically, it was the case of polyhydramnios. Okay, it is polyhydramnios. Okay, so anybody is very definite about whether it's a methotrexate, a single injection, or it was oral methotrexate or injection methotrexate? It is not oral, right? It's injection. Sign, is my short sufficient for AIIMS? Again, like I said, for NEET PG 23, it's the must do. There were like around 80 questions from short that were there in NEET PG 23. A lot of questions, more than 50 questions in the last AIIMS as well. So please do it for the upcoming AIIMS as well. Okay, do it for the AIIMS as well. Okay, let's go to the next one. Liver abscess wala jo question tha, alcoholic patient with diarrhea ka history, basically amoebic liver abscess, 75 cc was the volume given, and it will be first treatment. The question asked what will be the first treatment. It's going to be medical treatment first. Okay, it's going to be medical treatment first. Next, then there was a patient जिसमें blood transfusion दिया गया था 4 units, and after 4 hours now there were creps which were felt. So it was a case of fluid overload was what was there. Okay, fluid overload was there. ठीक है. Next one, inguinal canal opening, the image based question that was there, deep inguinal ring, and it was said that this opening is present in which of the following. So even if you were confused whether it's superficial or it's deep, we know that superficial is in the external oblique and deep is in the transversalis fascia. External oblique was not in the option, so the other opening has to be in the transversalis fascia. Okay, transversalis fascia. Yes, Dr. Ashutosh, NF100 will be helpful for AIIMS as well. ठीक है. Next one, tonsillitis में ear pain, the referred ear pain. It was glossopharyngeal nerve. The tympanic branch of glossopharyngeal nerve. It is what leads to basically the ear pain. Okay. Next one, allantois, the image-based question basically, where allantois was marked and it was asked कि इसका derivative क्या होता है, उसका remnant क्या होता है. It is median umbilical ligament. It is not the Meckel's diverticulum. It is median umbilical ligament. Okay, it's a median umbilical ligament. Next anatomy question, TM joint पे insert करने वाला muscle. We have discussed it in a short 150 as well. It is a lateral pterygoid. Right, we have discussed on YouTube as well. Ductus arteriosus, image-based question. It's a derivative of left sixth arch. Direct inguinal hernia was given. A defect where weakness of what part will lead to direct hernia? It is going to be conjoint tendon forming the posterior wall. Another image-based question of cock-up splint was given where the wrist was up. The cock-up splint radial nerve, remember the mnemonic Dr. Kumar? So Dr. Kumar drop is because of the radial nerve. So cock-up splint is the radial nerve palsy. Okay, radial nerve palsy. 9. ये जो 25 number का question है कल्पना, that was different question. The deep cervical fascia वाला. This was straightforward. Tonsillitis वाला was given with the ear pain. Okay. This one, how many of you have a confusion there, which is the liver abscess 75 cc, whether it is going to be medical treatment or it is going to be percutaneous drainage. Right, what will be the answer there? Anybody has any authentic source? So please do let me know there कि इसका first medical treatment आएगा कि direct percutaneous करेंगे. ठीक है? So please do let me know there as well. Okay. So whatever I'm marking as the stars basically are something where I would be looking for your help to get into the authentic reference for that. Okay. Next one, then we had tingling numbness in the radial 3.5 fingers. Okay. And the radial 3.5 fingers, we know that it's going to be carpal tunnel. It's not going to be Guillaume's canal. Guillaume's canal is ulnar nerve. And Fromenstein is also ulnar nerve. So you know that it was not Guyon's canal, it was not Fromenstein, so it was carpal tunnel with the Durkin compression test. Even if after Durkin compression nahi bhi pada ho, to bhi. Yes, the question definitely asked Hardik the next step. So medical is what I would go more in favor of than the percutaneous drainage. First is going to be medical. Then there was this image of patella, which looked like patella fracture. But like many of you said, the image itself mentioned ki bipartite patella us pe likha hua tha image pe. So we will go with that. And another finding which goes more in favor of bipartite patella is जो patella का basically two parts दिए हुए थे, right? In that it was the superolateral part of the patella which was there. The patella was not divided into equal halves. So let's go with bipartite patella. Okay, bipartite patella. Okay. Next one, spirometry graph is FRC, right? The graph which was given tidal volume ke niche. What is this one? This is going to be FRC. Again, a question that we have discussed so many times. Next one, right? So missed seeing on that, the bipartite was written there. So many missed seeing that. Okay. So bipartite patella में उसमें एक ही option था in that patella वाला. The rest of the three were the patella fracture. And only one option was bipartite patella, and do the X-ray of other knee as well. Basically, was the option which said do the X-ray of the other knee. Okay. Next one. The next image-based question of the cardiac action potential, where the plateau phase wala was correct. That phase 2 is because of calcium channel opening. Okay, phase 2 is because of calcium channel opening. Next, facilitated diffusion, the image-based question where the carrier was given closing and opening. It was facilitated diffusion. And next we have usme koi active transport nahi tha because there was no ATP there. Okay, this is something, I don't know, I would put it into the controversial thing. Where the potassium level given was 5.5, and what will happen to RMP? What will happen to RMP? So whether we should take this potassium as high, because some references say that 5.2 tak normal hai. So 5.5 will become high. In that case, the RMP will become more positive. And the next one will be calcium was there in the options. Calcium channel opening was there in the option, phase 2. Calcium was there in the option. Yes, 5.5 is what was mentioned, right? So if you take it as normal potassium, then there is no change in the RMP. If you take it as high potassium, and then it's going to be more positive RMP. So I'll put it into controversial question again. Next, another graph in physiology, the inulin wala graph. There was only one option where that graph which showed that 100% जो same रहेगा जिसका filtration के बाद nothing is changing. There's no absorption, there is no secretion. That is going to be inulin. Okay, that is going to be inulin. That was B. Only one option was there. Okay, only one option was there. हाँ, ठीक है. So this is inulin wala. Raw egg white, the image of a child, जो scalp दिखाया था, raw egg white. The answer was biotin. Next, a child, on polished rice, having cardiomegaly, pleural effusion, that is wet beriberi, thiamine deficiency, transketolase, diarrhea, dermatitis, dementia, it was niacin, black urine, alkaptonuria. There were 3 questions on thiamine basically, right? There were 3 questions on thiamine. एक जहां वर्निकेज दिया हुआ था, right, and it was asked कि कौन सा deficiency है. एक दूसरा जो वर्निकेज itself was in the option with the other options of delirium tremens, then it was Korsakoff's and D. Clarenbol's, right? So remember that it is mammillary bodies wala wernicase. Low insulin glucagon ratio, we have discussed almost all biochemistry questions in the last minute revision that we had, mega revision of biochemistry. It activates a hormone sensitive lipase, right? Then patient SACD वाला क्वेश्चन, पेलर है, स्टोमेटाइटिस है, proprioception affected है, it is SACD. Another question on zinc, where the clinical history of ectodermatitis enteropathica, basically the lesions around the mouth was given. Okay, lesions around the mouth was given. Yes. Next we have Januvarum, the bowing of the legs, the image which was there, it was vitamin D. Scurvy bleeding, it was a collagen defect. Gamma carboxyl, कौन से clotting factors में होते हैं? Vitamin K dependent clotting factors 2, 7, 9, 10 is what we know. Then a cherry red spot without organomegaly. So remember we had discussed the mnemonic here, T for tiny organs, that is Tay-Sachs. If it was big organs, big was pigs, then it was Niemann-Pigs. Anemia, bone pain, crumpled paper wala image, the 4 images, that was Gaucher's. The enzyme deficiency was asked. It was glucocerebrosidase, right? It was glucocerebrosidase, which was the enzyme deficient. Muscle cramps, low lactate, it is McArdle's. Hypoglycemia with absent glycogen in the liver. Okay? That is glycogen synthase. It is glycogen synthase. Remember, it was not branching or debranching. And then we had AML, where the image was given, the blast with the OR rods, and DIC ke features were given. DIC 1, 2, 3 letters. Remember, it is AML subtype M3. Blindness ka history was there, Shashank. It was already given कि बच्चे को blindness है. Cherry red spot without organomegaly. It is going to be Tay-Sachs only. Why not branching enzyme? Because if it was branching, that means it is Anderson's. And in Anderson's, you would see the deposits of that abnormal glycogen, long glycogen, amylopectin jaisa in the liver. This said that the glycogen was absent. Okay, the glycogen was absent. DIC AML M3, remember 3 के table में 15 आता है, so it is translocation 15, 17. Okay. Next one, what do we have? Yes, I remember we had discussed this glycogen synthase wala question in short 150 when we did the questions on glycogen storage disorders. Okay, jaw swelling, child with jaw swelling, translocation was already given and the diagnosis was asked. It was Burkitt's. There was an image also which was given for Burkitt's. Next we have spike and dome pattern. This was hepatitis B positive patient. This is membranous, has the spike and dome pattern. Pyoderma ka history, cola urine, it is PSGN, it is subepithelial deposits is what it would be there. Okay, subepithelial deposits. Good prognostic factor in breast cancer, it is ER positive. Logically answering, agar ER positive hai, we can give the hormone wala therapy, right? So remember ER positive, it is going to be good prognostic factor. CLL image based question, smudge cell was given. What is the next step? The next step is going to be flow cytometry. Okay, the next step is going to be flow cytometry. Any queries so far, anyone? No, we will go with subepithelial deposits in that case of PSGN. Right, why do you want to go for crescent? RPGN का history क्या था उसमें? There was 3 weeks later PSGN progressing into RPGN. Should I? So let me do one thing. Let me put this because it's leading to confusion. So better to put it into the controversial question कि ये RPGN है, PSGN turning into RPGN or it's PSGN. I will put it as a controversial question. Better to put it into controversial question. Okay? Right? ठीक है. Next one, hypercalcemia was the keyword there. The patient was a smoker and it is going to be squamous cell carcinoma there. Hypercalcemia we have discussed in one of the recent NF100. Recent NF100. Right, so the paraneoplastic squamous cell carcinoma. Next question, digoxin numerical 4 nanogram से 1 nanogram जाने के लिए कितना time लगेगा? The half life given was 40 hours. It is 2 half lives 80 hours. Low platelet, remember Oprel vacant is 0 platelet. Low platelet में Oprel vacant, which is interleukin 11 wala. What drug used in gout acts by inhibiting the uric acid synthesis? And it is going to be allopurinol. So I can see two very bipolar comments here. Someone says PSG and are confirmed, and another person says it is definitely crescent. So, so just to satisfy both, I'll keep it into controversial question. ठीक है? हाँ, तो large atypical cells, any cancer basically has that, the NC ratio और वो सब आप देखते हो. Okay, next one, aspirin toxicity, question discussed in one of the recent KBMD episodes. Aspirin, salicylic acid, acidic drug. So we will use bicarbonate to alkalinize the urine. Okay, this one, I think we might have to change the answer here. A thyrotoxicosis patient with atrial fibrillation. What is the immediate management? I remember seeing a similar sort of question in one of the USMLE question bank. There, the answer given was esmolol, even though it was an asthmatic patient, but esmolol is beta-1 selective. Esmolol is beta-1 selective. M tak wale beta selective होते हैं, except few. So, in the thyrotoxicosis, the cause of atrial fibrillation is because of thyroid hormone वाला. तो उसमें था कि thyrotoxicosis के arrhythmias के लिए esmolol is preferred. But again, if the primary concern is atrial fibrillation को treat करना, तो वो case में maybe we can go with diltiazem as well to satisfy everything. So another question that I will put into controversial, because I think it can be esmolol, because I said I remember seeing a similar question there somewhere, and many of you say diltiazem, so I would go in that case with that as well. So I'll put it into controversial. Okay, no more discussions there. Next one. A patient on steroids for asthma now has oral white में tongue वगैरह में सब white दिया हुआ था. Basically that was oral candidiasis. So the drug there would be clotrimazole. Okay, the drug there would be clotrimazole. Okay. Esmolol is beta-1 selective, right? Asthmatic mein, it is beta-2 blocking drugs that we are worried about, but esmolol is beta-1 selective. Okay? Pertussis. I don't know why. Anybody has a very authentic resource to this? Pertussis ka clinical scenario diya hua tha, whooping cough, and the drug of choice was asked. Azithromycin tha option mein, clarithromycin tha option mein, right? Then there was amox and cotrimoxazole. So why is it azithro over clarithro? नो श्रद्धा, रिदम कंट्रोल के लिए बीटा ब्लॉकर नहीं है, वो रेट कंट्रोल के लिए है. रिदम कंट्रोल इज योर एब्यूटेलाइड एंड ऑल ऑफ दैट. It was definitely pertussis, whooping cough. Azithromycin is the drug of choice. Like I saw some resources which said azithro, clarithro, erythro है वैसे तो drug of choice, but erythro was not given in the option itself. So we will go with azithromycin. Dr. Aditya, there was a question on pertussis, क्योंकि उसमें दिया था कि साइनोसिस हो रहा है, पूरा ब्रीदिंग अफेक्ट हो रहा है. There are paroxysmal cough was what was given. Paroxysms, right? So azithro is what we will go for. Whooping नहीं लिखा था, वो that is what you had to derive. Next one, a patient with urethral discharge, the gram stain image was given, which had those pink color diplococci. What is the drug of choice there? For Neisseria, it's going to be ceftriaxone. Okay, for Neisseria, it's going to be ceftriaxone. Okay, going to the next one. Pulmonary fibrosis, hypothyroidism. What is the side effect of which drug? All of us know, many times this is asked. Amiodarone, INICT asked about the blue man as well, right? It causes photosensitivity, skin effect as well. Okay? Okay, next one, cardiac surgery. A person is about to go cardiac surgery. What drug will you use for prophylaxis? Surgical infection prophylaxis. Cefazolin. We have discussed in one of the KBMDs. Cefazolin, zero karne wala, infection rate ko zero karne wala is cefazolin. Okay, that is cefazolin. Okay, propylthiouracil is never the first drug there. It takes some time to act. The propylthiouracil answer nahi hai. Okay. Next one, what was that image-based question was there, which was given, which is a drug which acts at both the site. One was that NEP wala site, other was that AT1 wala site, and that is going to be Omapatrilat, which is going to be both. Okay, omapatrilat is the answer there. It's not sacubitril or necessary. Omapatrilat is the answer there. Next question, the image-based question, where one hand was on the chin, one on the head. So logically thinking, it is going to be chin lift, head tilt and chin lift. It was not jaw thrust. Both the hands was not on the jaw. Okay. Sacubitril nahi. Okay, it is omapatrilat, which is the answer. Next one, tracheostomy device image was there, and it is not used for upper airway assessment. It is used for pulmonary lavage. It is used for prolonged mechanical ventilation, upper airway obstruction, right? So that is what it is going to be. Next one. Then right lateral recumbent position, वो जो resuscitation में दिया हुआ था, the recovery position basically, that position is given when the patient is unresponsive, but both the pulse and breathing are present. Okay, both the pulse and breathing are present. So that is going to be the answer there. Another clinical history of laterism. So what was responsible? BOAA. So basically 2 questions on laterism is what we had. Next, TB sputum, TB ka patient, sputum smear is negative, the patient is symptomatic, chest x-ray is positive. It is going to be CB NAT. What is the next thing that we would do? It is going to be CB NAT. Okay, CB NAT. Kalpana 72, tracheostomy जो device image based question था, this device is not used for which of the following indications? It is not used for upper airway assessment. ठीक है? Okay. Next one, what is that procedure called as, where you see that जिनका blood pressure बचपन में कम है, बड़े होके उनका कम है, जिनका high है, it's going to be high. That is basically tracking. Okay, that is basically tracking. Next one, the history of a person working in a factory, cement, concrete, varnish, paint. It is vibration leading to the white fingers. Okay, the white finger wala is vibration. Vibration is what it is. Next one, hair dye image based question जो female का था, allergy वाला hair dye, it is PPD. Okay, it is PPD is the answer there. Okay. Right. What was the question? Next question on RDA, the recommended dietary allowance. It is the satisfying the needs of 97.5%. If it was 50% population का need satisfying, it is estimated average requirement. That is for 50%. RDA is for 97.5%. ठीक है? Next one, pregnant female not taking mango, papaya throughout the pregnancy, thinking that it is abort efficient. Then the answer for that is Anganwadi workers should take care of the nutrition, education, and all of that. ठीक है? Okay. Going on to the next one. Meningitis wala history tha, where there was a neck rigidity. The question said it is gram-negative bacilli which is responsible, and the answer there would be satellitism. Satellitism. PPD was paraphenylene diamine, right? The content in the dye. ASHA, I don't know, this is Anganwadi worker or ASHA. Again, this is something, if you remember the exact wordings of the question, then this could be ASHA as well. I'll better put it into controversial question so that all of you put it like, chalo, isko hum wrong mark ke chalte. So, ठीक है? ठीक है. So probably because you are saying कि home visit was particularly mentioned, तो हम उसको आशा भी कर सकते हैं. I'll put it into controversial question. Okay, so that's better. Next one. Next one क्या था? CMV पे 2 questions थे. CMV पे home 2 question. One was owl's eye वाला question. Second was periventricular calcification and hearing loss. That is going to be CMV. ठीक है? Then PDA cataract का history. It is rubella. That image of the terms conoid was given. Right, what refractive error is that? It is astigmatism. Next one, fungus GMS पे black crescent दे रहा है, KOH mount वगैरह पे कुछ नहीं है. GMS silver staining, that is for PCP. Right, the GMS staining is PCP. Okay. ठीक है. Asha, I'll give you some Asha with that. I've told you that we will put it into controversial question. Okay, so everybody be happy about it. कि हम इसको कहीं नहीं डाल रहे हैं. We'll get into exact. You guys can share the reference books ka image so that we can get to the right answers. Satellitism was definitely there in option Vishal. नेक्स्ट, एक दिल्ली में पेशेंट है जिसका लो हीमोग्लोबिन है, प्लेटलेट काउंट कम है, पेटिकियल हेमरेजेस दिए हुए थे. दैट इज अ केस ऑफ डेंगू. ओके, दैट्स अ केस ऑफ डेंगू. नेक्स्ट वन लेप्टोस्पायरोसिस वाला हिस्ट्री था, फार्मर था, रेड कंजंक्टिवाइटिस वगैरह दिया हुआ था. वी विल द बेस्ट फॉर डायग्नोसिस वुड बी मैट. ठीक है, दैट इज गोइंग टू बी मैट. सीवेज वर्कर, आई थिंक फिर ये वाला ही होगा, ये जो लेप्टोस्पायरोसिस वाला था. A sewage worker, that is going to be leptospirosis. PCP, pneumocystis. I thought it's a standard abbreviation, pneumocystis. 90 number, एक जो peripheral smear का image था, where inside a macrophage, the bone marrow, it said it's a bone marrow aspiration का image, and it is उसके अंदर कुछ mark किया हुआ था. There were 2 arrows given. So macrophage के अंदर होता है histoplasma. Right, so we will go with histoplasma wala. Nahin, the platelet was not 2 lakhs, it was 20,000. MAT was macroscopic agglutination test, right? The agglutination test. 89 में options were Dreamer. The options of 89 leptospirosis, one was MAT. One was Wheel Felix, Paul Bunnell. These were the other 2 options, and one was Vidal, I believe. Rajasthan wala दूसरा question है भाई. Rajasthan wala, we are coming to another question. हाँ, राजस्थान वाला काइनेटोप्लास्ट वाला है, वो है लिशमेनिया. सो वन वाज हिस्टोप्लाज्मा एंड द अदर इज लिशमेनिया. नेक्स्ट क्वेश्चन वाज व्हिच ऑफ द फॉलोइंग इज ट्रू अबाउट ट्राइकोमोनास. कैन नॉट बी कल्चर्ड इज इनकरेक्ट. इट कैन बी कल्चर्ड. Twitching motility, it can definitely be cultured, so it is going to be twitching motility is seen, that is going to be correct. ये वाला है लिशमेनिया, जो राजस्थान का पेशेंट था, स्किन लीजन था, काइनेटोप्लास्ट, ए मेस्टिगोड वगैरह दिया हुआ था. दैट इज गोइंग टू बी लिशमेनिया. ओके, दैट्स गोइंग टू बी लिशमेनिया. ओके, filaria भी वो दूसरा क्वेश्चन आ रहा है. Filaria is another. There were a lot of questions on infections. This was like the favorite question for me. I just put the mnemonic 2-3 days back on my YouTube channel for Florence and Barberio's test. Remember picric, barber ka prick, that is picric acid. Okay, that is picric acid. Next, this was the question, IPC 314, again based on, we have discussed the mnemonic. 4 is the foul play happening and the mother dying. So this was the answer, right? This was the question and this was the answer. Mother death in miscarriage, that is what it is going to be. ठीक है? Next one. अच्छा. नेक्स्ट वन क्वेश्चन पे जाते हैं. दैट इज HIV पॉजिटिव में ऑटोप्सी का टेक्निक रॉकी टांस्की. रिमेंबर इन सीटू रॉकी टांस्की, जब इन्फेक्शन होता है दैट इज व्हेन वी डू. सो रॉकी टांस्की इज इन सीटू, इन इज इन्फेक्शन. टंग टू प्रोस्टेट पूरा ऑटोप्सी, दैट इज गोइंग टू बी ले टू ले, लाइक सब कुछ तू ले ले, एंटायर एन मास, and that could be lay to lay. Okay, lectule and however you want to pronounce it. Next, convulsions, back arching wala history, that was strychnine poisoning. A child eats fruit and while playing, that was datura and physostigmine. PM calorie CD, the temperature increasing post death, that is going to be septicemia. Okay, that is going to be septicemia. Chalo, amazing. Many of you got that picric acid wala right. If you had seen the video recently, hai na, so hope that saved one question and 4 marks for you. OPC poisoning, now presenting with fever. NMAS is letus, GONS is focus, and block, where you do one cavity at a time. This was given कि पूरा टंग से प्रोस्टेट तक हमने पूरा साथ में निकाल दिया. That is going to be NMAS. Okay, OPC poisoning and now fever, it's atropine toxicity. Trauma ka patient CT frontal sinus was given, which was expanding. That is frontal mucosine. It was a coronal CT image. The orbit के ऊपर ये frontal sinus दिया हुआ था. The orbit was separate, so it is not pseudotumor. It is not meningioma. And what was the other option there? इसमें जो options थे दूसरे, the other options were, one was a pseudotumor, one was a meningioma, and what was the other option there? Don't remember the next, but it's frontal mucosine. Next, when both the eyes, right side of the vision is gone, right homonymous hemianopia, that's going to be left optic tract. Another question of that, okay, meningocele. It was definitely not meningocele as well, right? ठीक है. Golden ring दिया है. What will help in diagnosis? The ceruloplasmin levels. So basically, this was Wilson's disease. Angiofibroma, yes, absolutely right. The one of the option was angiofibroma. Angiofibroma frontal sinus के अंदर नहीं जाएगा, right? So even that is out. Pseudotumor is out. It was not a meningioma. Meningioma will not come within the frontal sinus. It's a mucosele, right? It's a mucosele. So by ruling out the options, you could come to the answer as well. Nahi, not at all. It was not bitemporal hemianopia. In bitemporal hemianopia, if you see, in the right eye, it's the right side. In the left eye, it's the left side which is gone. Here it was given that both the eyes, the right half was gone. So it was homonymous hemianopia. Okay, it was homonymous hemianopia. Okay. Okay, next one. Mid-diastolic murmur with raised A wave. Think straightforward, it's tricuspid stenosis. Mitral stenosis, back pressure करके फिर raised A wave कर सकता है. But straightforward सोचेंगे तो tricuspid stenosis. Okay. Okay, going to the next one. Mid-diastolic murmur can be TS or MS as well. Murmur का image based question. S1 and S2 के बीच का murmur, a pansystolic murmur का image. It was mitral regurgitation. Then platelet नहीं. Palate. Okay, this is palate का image based question. HIV positive patient, that is Kaposi's sarcoma. Okay, that is Kaposi's sarcoma. And chest x-ray was given with the tumor here in the lung apex. Horner's ka history was there. It is Pancoast tumor. ECG में tall T waves were given. Right? ECG में tall T waves. Yes, any queries here? Any queries here? How many of you think that the ring was given in the iris? How many of you think that this one was the iris wala ring? Pulmonary edema was not mentioned in that mitral stenosis wala, right? Chalo. We'll go with ceruloplasmin because that's the one which is most frequently asked in the exam. So considering that Wilson's is there in all exam, we'll go with ceruloplasmin. Okay. And if at all you guys want to be happy, I'll put it into controversial question. ये iris दिया था, उसका आंसर क्या है फिर आप बताना. ठीक है. 82 का क्या हुआ? 82 पे तो हम देख लिया ना already. चलो next one. ECG tall wave, spironolactone. So remember that spironolactone hyperkalemia cause करके that will cause tall T waves. Okay, that will cause tall T waves. Next one that we had, that image based question of the procedure, that was intraosseous fluid therapy. Intraosseous fluid therapy. Okay. Next one, keloid ka image based question was there, right? It was keloid. It was not neurofibroma or hemangioma. CEAP, another repeat question. CEAP is the favorite. I hope all of you remember the mnemonic TVE SHA. 1, 2, 3, 4. The skin changes come in C4. and we had remembered it as eczema. A is eczema. So that then in that case, it is going to be C4A. Okay, it is going to be C4A. Next one, what do we have? Q SOFA score, another from our mnemonic again, RTS, revised from our score jaisa. Respiratory rate, trauma mein we do GCS and systolic blood pressure. Next one, GCS wale ka answer, E2, V3, M4. Painful stimulus, inappropriate speech, M4 was withdrawal. I hope all of you remembered the story mnemonic there. Okay, all of you had, yes, I know that there was no image in that iris wala. Okay, next one. This is nerve mein. A patient who is undergoing a laparoscopic surgery for hernia, and it was given that the nerve is trapped. Okay, nerve is trapped in the fixator. What is going to be the nerve affected? There were history of the pain in the lower limb as well. There was pain in the lower limb, history was also there, and that is why it is lateral cutaneous nerve of thigh. Okay, lateral cutaneous nerve of thigh. Next one, it is the image-based question of CA penis. Verrucous carcinoma was already mentioned. Carcinoma mein we will do partial penectomy. There was no lymph nodes there. Okay, there were no lymph nodes there. Okay. Next one, what do we have? What is the disadvantage of lap surgery? Delayed recognition of electrosurgical burns because the rest of them did not seem logical. Ki more bleeding hoga, delayed recovery hoga. Delayed recognition of the burns is what would be there. Okay. Okay, let's go to the next one. Koplik spots, direct question, measles, x-ray, scalp swelling. 2 months tak the swelling is persisting, right? And it had that crescent jaisa shape with the calcified margin. Caput and all of those, they cross the midline. They are not limited at one side, and they resolve also earlier. So I would definitely like to go for cephal hematoma. Okay, I would like to go for cephal hematoma is what I would go with. Sweat chloride, straightforward question, cystic fibrosis. 1 year adequate growth for a child in a 1 year, eating well, nutrition well. Adequate growth is defined by length increases by 25 centimeters. Okay, length increases by 25 centimeters. Okay. Next one. What is the query, guys? What's the query there? Encephalocele generally will not have that calcified margin. Caput, subgaleal, they should resolve early. ये 2 months तक persist कर रहा था. When does the cephal hematoma develop? When does the cephal hematoma develop, and what's the cause of cephal hematoma? Yes? Chalo, let's go ahead. Steeple sign, LTB, croup, it's a repeat question. The X-ray image was given. Vaginal discharge with cervical erosion, it's a green kit. Right, I would go with green kit for sure with this question. Cervical erosion in itself, it was not directly mentioned. Cervical ulcer, right? Vaginal discharge was given, and so I would like to go with green kit for that. Okay. Okay, let's go. It's vaginal discharge. When the mother has cervical cancer, what will you advise in the daughter? HPV vaccine is what is going to be the answer there. Registry, the options of adequate growth in the 1-year-old child. The other options was ekta anterior fontanelle closes by 6 months. One was the weight gain wala option where it increases by 300 grams per month. That was one option, and the fourth option I don't remember. Okay. Let's go with the next one. Contraindicated in asthma, the drug that is contraindicated labor में uterotonic carboprost will be contraindicated. Okay, carboprost will be contraindicated in asthmatic. Labia ka swelling, none of the options fitted into that. By ruling out the options, there were not multiple vesicles to call it herpes, or there was not that curdy discharge to call it candida. We will go with Bartholin's abscess. Okay, we will go with Bartholin's abscess. ठीक है, चलो नेक्स्ट वन करते हैं. Oh yes, the fourth option here was weight is 75 percentile and height is 25 percentile. Seemed incorrect for sure. Okay. Next one, partogram ka image based question. It is the answer there is going to be immediate caesarean section. Oxytocin was already given. There was rupture of membranes, meconium present. So immediate C-section is what we will go with that. Okay. Next one, transverse lie wala, where everything was good. There was no risk factor, 36.6 weeks. So we will go with external cephalic version. Okay, external cephalic version. Hydatid CT was given and it was a straightforward. It was echinococcus is the cause there. Okay, that was hydatid. X-ray ka red eye backache, that was ankylosing spondylitis where the bamboo spine dagger sign was given. Sterile pyuria X-ray where the kidney was calcified, putty kidney. City brain alcoholic 2 weeks. When I cross check again and look at the question again, it looked like EDH. Like in the first recall I told you it looked like EDH. It definitely looked like EDH if you would have just gone by the shape. But what we also forgot there is कि वहाँ पे एक suture का site भी है and it was crossing the suture plus the history there. Okay. Plus the history there कि 2 weeks का history था. So long standing history we will go with SGH. ठीक है. So it looked like EDH, but the suture को cross करने वाला, so it is going to be SDH. Okay, let's go with SDH with that. चलो, next one. Shefford-Crook deformity, fibrous dysplasia. Ulna का lesion, it's going to be GCT, it's not ABC. ये वाला 19 years पे fuse हो जाता है, so it is after fusion. It was going involving the epiphysis, the bone end. It is GCT. USD वाला was OHSS, IVF वाला patient. ठीक है. And Colombo plan. For Colombo plan, the answer is cobalt therapy units. This has been given in your Parks textbook as well. Okay. So that is going to be cobalt therapy. हाँ वो bamboo spine ही था. It did involve epiphysis for sure. It went till the bone end. Okay. Okay, let's go to the next one. Chest pain, mediastinal widening, blood pressure unequal in the upper limbs. It is aortic dissection. Panic disorder wala question. Every month attacks lasting for 30 minutes, impending heart attack. It is panic disorder. Aneurysmal bone cyst is unfused skeleton and metaphysis involvement. It's not epiphyseal involvement. GCT is fused skeleton and it is going till the bone end. Epiphysis is involved. Okay, unicameral bone cyst तो बिल्कुल नहीं रहेगा. Unicameral is unilocular bone cyst. You were seeing that soap bubble appearance there. There were multiple trabeculations there. ठीक है? Okay, next one. Increased salivation are mnemonic there. Clozapine, पीने वाला hypersalivation. That was clozapine. Okay, that was clozapine. OHSS, ovarian hyperstimulation syndrome basically. Black skin lesion growing in the child, that is going to be risk of melanoma. Okay, that's going to be the risk of melanoma. Okay. Generalized anxiety disorder, remember that it's generalized. That means all the time the patient will be anxious about something. Life में कुछ problem नहीं है तो भी tension है. That is how the patient is. It does not come as attacks. This was a history of attacks. That is what happens in panic disorder. Okay. Next one. Next one was HIV positive skin lesions and lung, which look like molluscum very much because of the umbilicated lesions that were there. But the involvement of the lung as well, molluscum में lung involved नहीं होता है. So remember that it is disseminated histoplasma. Okay, it is disseminated histoplasma. ठीक है. I know many of you are very impatient to go to 200. थोड़ा सा patience रखो to get this 200 recall. Next one, Alpha fetoprotein was raised, and that is why that makes the answer as HCC. Okay, that makes the answer as HCC. Okay, and the next, hepatitis B cut treatment, HBsAg positive, everything positive, we give monotherapy. So tenofovir is going to be the answer there. That's going to be tenofovir. Okay. Alpha fetoprotein was definitely given there. ALP alag tha, but alpha fetoprotein was mentioned in the last line. Okay. Next one. This one. Bile duct proliferation with the plugs in the bile ducts. A baby with gradually developing obstructive jaundice, 4 months wala. What do you think is the answer to that one, guys? Malas ka mein ye nahi hoga. Is it not that EHBA, the extrahepatic biliary atresia, it is going to be immediately after birth, a neonate presents with obstructive jaundice? I mean, that was my only query there. I am not pretty sure about it. What I remembered was कि neonate में आ जाता है obstructive jaundice at birth itself, and it was a 4-month gradually developing jaundice. So that was the only confusion there. This is something where I would like you to cross check again there. Black liver नहीं mentioned था, the Dubin Johnson नहीं हो सकता. Black liver was not mentioned there. It is not Krigler's because this was doctors are conjugated. एक वो Krigler's तो ये हो ही नहीं सकता, ठीक है? So Dubin Johnson is conjugated again. Dubin Johnson is also conjugated. So need to confirm about this कि इसमें होता क्या है, okay? हाँ तो Dubin Johnson में तो liver में changes आते हैं ना? Okay. I would still like to cross check for myself on this EHBA versus Dubin Johnson. ठीक है? Next one, cirrhosis में anastomosis किसमें होगा? It is going to be left gastric and esophageal logical varices होते हैं, esophageal varices. ठीक है? Corneal ulcer, is this the correct answer? Fluorescent dye is used with cobalt filter. Anybody could confirm there? Pale stools, Dubin Johnson में भी होगा ना? It is also conjugated one. It's an obstructive jaundice, right? So I don't know. Achha, is this correct? Fluorescent dye, cobalt filter, everyone there? Yes, okay. Rini is positive for 1024 Hertz. Rini's was negative for 256. 512, the airborne gap of 30 to 45 decibels, right? Confirm from your ENT book. Green filter bhi tha. I know there was the option of green filter also. That's what I'm asking you. What is the correct answer? I don't know the correct answer myself to this. That's why I'm asking you iska correct answer kya hai. Can someone please cross verify what will be the answer to that? Okay. Green filter and fluorescent, not the cobalt filter. सबको आप लोग कोई confusion है, so I don't know. I need to cross check for myself this one. I'll put it as a star. Mesothelioma asbestosis. Mesothelioma asbestosis. Temporal lobe, दो question थे herpes simplex पे basically. Okay, so it is temporal lobe herpes simplex. One was that. Another already question में दिया हुआ था temporal lobe. It is herpes encephalitis. How will you confirm the diagnosis? It is going to be DNA PCR for CSF. CSF का ये. Perineal painless ulcer with plainless lymph node. It is going to be syphilis. Right, that's going to be syphilis. Next one, female with abdominal pain, dysuria, intermenstrual bleeding. Anybody remembers that question? What will be the causative agent? Chlamydia था option में, I don't know, और candida था, Neisseria था. 149 के बाकी ऑप्शन तो मुझे याद नहीं है. Mesothelioma is definitely asbestos. Fluorescent and cobalt filter is confirmed from the faculty, so we can remove that. ठीक है, बताओ मुझे, आंसर बताओ, आंसर बताओ. शैंक्राइड में तो पेनफुल अल्सर होता है, वो शैंक्राइड तो नहीं है. आई वांट यू टू रिकलेक्ट दिस क्वेश्चन हियर. The discharge was urethral discharge, right? The discharge was a urethral discharge. Gonorrhea causes urethral discharge, now PID with urethral discharge, right? There was discharge mentioned, but not the cervical or vaginal discharge. It was urethral discharge. It was intermenstrual bleeding. क्या intervaginal bleeding क्या होता है? गोनोरिया, ठीक है, करेक्ट. अनदर एक्सरे बेस्ड क्वेश्चन वेयर फिबुला का कहां पे फ्रैक्चर होगा, तो फिबुला का नेक वाला जो यहां पे था, नीचे वाला नेक वाला, दैट इज गोइंग टू बी द आंसर. दैट विल कॉज द फुट ड्रॉप. ओके, दैट इज गोइंग टू बी द फुट ड्रॉप. This one is syphilis, this one is gonorrhea. Okay, चलो next one. क्लोनिडीन स्टॉप. पेशेंट स्मोकिंग वाला पेशेंट था, निकोटिन ले रहा था, क्लोनिडीन ले रहा था, and now the clonidine is stopped and now the patient has headache. Clonidine, we know the side effect with clonidine withdrawal. It is going to be rebound hypertension. Okay, it is going to be rebound hypertension. Great toe pain and it was raised WBC. Uric acid was normal. Now remember that during acute attack of gout, the uric acid levels rather can be normal or even low, right? So this is going to be gout. This is not septic arthritis because there was no history of fever, not reactive because there was no dysentery, nothing was there. Right, pseudo gout is not the great toe, it involves the knee vagera, the larger joints there. So this is gout. Okay, this one is going to be gout. Next one. HRP2 positive is Plasmodium falciparum. Okay, that is going to be Plasmodium falciparum. Next one, Fournier's gangrene wala. This is a repeat question, I believe, and the answer was it's a polymicrobial infection. Fever nahi tha wo question mein. Fever was not there. Clearly, there was no history of fever. Okay, I can be very much sure about it. Fever was not mentioned. Fever was not mentioned. It was clearly mentioned in that line that there's no fever, no dysentery, no diarrhea, nothing. Okay, so fever was not there. Okay, going to the next one. Chest X-ray is allowed. क्योंकि फीवर नहीं था इसलिए did not go with septic. No fever. Chest X-ray में there was this allowed sign which was given with the right heart border. It was middle lobe pneumonia, what not pleural effusion or not the lower lobe pneumonia. It was middle lobe pneumonia. Next one, what is neoadjuvant chemotherapy? It is before the surgery. Okay, it is before the surgery. True about radiation, inversely related to the square of the distance. Other options was normal cells, cancer cells equally affected, not there. And next it was the other options, mucosa is resistant, incorrect, right? So it is inversely related. Premature ejaculation, the first method is the squeeze method. Okay, the squeeze method. School child, what vaccine will you give? School child, what vaccine will you give? It is the TD. Okay, that's the TD. Cyclical pain, anterior vagina collection. There was pubic symphysis ke वहाँ swelling था. Can someone tell me the answer to this one? I'm not sure whether this is transverse vaginal septum or this is imperforate hymen. It was transverse vaginal septum or it is okay, so let's go with the answer of imperforate hymen. Okay, we'll go with the answer of imperforate hymen. Okay. What was the next one? Swelling in the front of the ear. It was not lower down. It was yahan pe. Whether it was dermoid, sebaceous, parotid tumor, or the jaw tumor. Anyone knows definite answer to that? पक्का पता होगा तो बताना. This one is something that I'll put into that. Okay, I am putting this one into controversial. Imperforate hymen, transverse vaginal wala, or variable consistency mobile was given. Variable consistency mobile, everything was given there. Parotid tumor, sebaceous, I don't know. Faculty said parotid because the image that the faculties are showing in the recall is the image here lower down. This was much above and anterior to the ear. So I'll put it into controversial. Don't know the answer to that exactly. Okay, need to hunt for that. Iron supplementation starts at 14 weeks, correct? Because the faculty does not know what the image was, right? Anybody knows the answer? वो anemia वाला का क्या है? You need to give me answer to this because I'm not sure about it, so I will not comment on that. Okay. Next one, chronic pancreatitis. The option of pancreatic or jejunostomy, the longitudinal one, is what we are going to go with that. Okay. Okay, majority of you are saying it's 8 to 10 weeks itself. क्योंकि तब मालूम पड़ा तो तब से दो. As I said, give me the reference source, then we will get to the right answer. Next one. TPA is given in MI for fibrinolysis. Resting tremor, rigidity, emotional expression में difficulty है. Where is the lesion? It is the basal ganglia. Okay, it is the basal ganglia. Because resting tremor, rigidity would be basal ganglia का lesion. Lewy bodies वाला, there was no option of Lewy body dementia there, right? So Lewy bodies, we would go with Parkinson's. Okay, we'll go with Parkinson's. Hematemesis, melena wala question. Patient is taking occasional alcohol and taking aspirin since long, and that is going to be peptic ulcer disease. Okay, that's going to be peptic ulcer disease is what is going to be there. Okay. Prion में there should be history of those myoclonic jerks, right? Progressing very fast. उसमें Lewy bodies नहीं आएंगे. Okay, next one, premature baby, insufficient production of lecithin, basically a question of RDS. Another question on RDS, the respiratory distress syndrome, increases the surface tension, decreases the compliance, right? अगर वो नहीं बनेगा surfactant, तो surface tension बढ़ जाएगा because surfactant reduces the surface tension and it is decreased the compliance, okay? Next one. Next swelling moves with tongue protrusion. Tongue wala is thyroglossal. Glossal, tongue se move karne wala, right? Next one, managed with hysteroscopy. Asherman's or cervical polyp. Of course, वो subserosal वाला तो hysteroscopy से नहीं करेंगे. Tubal ligation laparoscopy में करते हैं, hysteroscopy में नहीं करते हैं, है ना? So this is Asherman's or cervical polyp. Polyp तो सिर्फ ऐसे ही polypectomy होगा cervical का. So I believe this could be Asherman's. What do you think, guys? Right, so we will go with Asherman's. Okay, we will go with Asherman's. Next one, retroperitoneal hematoma, joint bleed, no mucosal bleed. No mucosal bleed, von Willebrand's is out. Joint wala bleeding, that's hemophilia. So hemophilia is going to be factor 8 and factor 9 deficiency. Classically, hemarthrosis is a feature of hemophilia. So it is factor 8 and 9 deficiency. Next one, which is the best indicator of availability, utilization, development, country वगैरह का एक ऐसा क्वेश्चन था जिसका आंसर होगा जिसका आंसर होगा इन्फेंट मोर्टेलिटी रेट. आई रिमेंबर सीइंग इट समवेयर एज अ वन लाइनर कि IMR is the best indicator. All of you agree to that? Write down the question number 175 and a thumbs up so that I know that all of you are agreeing to that and all of us are on the same page. Chalo quickly, 175. 175, it's IMR, the infant mortality rate. Yes, waiting for those thumbs up there. Quickly. Krupa Jariwala, Melina means it is upper GI bleed, not the lower GI bleed. Lower GI will give a fresh blood in the stools. चलो, very good. I got those. Next. Corrosive लिया है पेशेंट ने, अभी 90% सोडियम हाइड्रोक्साइड था, फ्लोर क्लीनर वाला हिस्ट्री था, and now the patient has dysphagia. What should be done? Esophagojejunostomy, or it was stenting or feeding jejunostomy. Everybody agrees to this, feeding jejunostomy, right? Okay, great. Filaria antigen positive, what is the next test which will help in the management? DEC provocation is what we will go for. Okay, DEC provocation is what we will go for. Next one. Heat stroke, which of the following will not be present? I believe this is a repeat question from NEET PG 21 as well. Okay, so that is going to be sweating. Sweating will be absent. Okay, sweating will be absent. "22-year-old female brought by mother-in-law, a very, very impatient mother-in-law who wants a granddaughter, grandson very soon, and took the daughter-in-law to the doctor ki 6 months se cohabitation hai, but no child yet. And the doctor is like, have some patience, reassure, and wait for 6 more months. We need to be, we need to have the definition of infertility is 1 year patience is what we need, right? Complete 1 year. So that is the reassure and wait for 6 months. Okay. Pregnant female, the blood pressure decreases on lying down. Lying down पे blood pressure decreasing, बैठने पे better हो रहा है, then it's IVC compression. Okay, then it's going to be IVC compression. Next one was, how do you calculate the years of potential life lost? Was कुछ YPLL या PYLL was mentioned. What is that? It was, so it is calculated based on the years of premature death. Okay, remember it is premature death. It is not the disability, it is not morbidity, it is premature death is what it is. Another question on thymine deficiency. So 3 questions on thymine. Okay, 3 questions on thymine. Thank you so much, Prakhar. I hope it helped you and everybody. Next one. Now these are the questions that I put in red क्योंकि मुझे यहाँ पे कुछ चाहिए the clarification on these. So one was whether the rectal polyp, a child with rectal polyp with mucus and neutrophils, is it rectal adenoma or hematoma? Got confused then because mucus था तो adenoma हो सकता है, glands में से mucus आ रहा है. So whether it was adenoma or hematoma. Quickly. Just because mucus was mentioned, and that's the reason that was the confusing point there. Mucus and neutrophils was mentioned, so it is adenoma or it was hematoma. Adenoma because the mucus was present. Chalo. Put it as a controversial question because mucus के वजह से adenoma होना चाहिए इसलिए. ठीक है. Spherocytes, a young child. So I would personally go with the osmotic fragility test, right? Spherocytes are also seen in autoimmune hemolytic anemia. So don't know what was there in the examiner's head while putting that question. Okay. So that was another controversial. You can count it as much as, you know, as you like. ठीक है. Next one. Red में clear नहीं दिख रहा है, मैं इसको कुछ नहीं कर सकती क्योंकि ये ऐसे ही रहेगा. Okay, this options that IBQ tracheostomy wala jo tha, what surgery the patient had undergone? It is partial laryngectomy, total laryngectomy, standard tracheostomy, percutaneous tracheostomy. What is that? Anybody knows the answer to that? What was that surgery? What tracheostomy? I don't know the answer to that. That's why I put this in red. Right. So ये वाले questions का आंसर मुझे नहीं पता है. So आप खुद के हिसाब से decide कर लेना whatever you want to take it as right. Next is varicella in boys hostel. I would go with the answer of isolation करो, acyclovir दो and immunoglobulin दो within 72 hours to the susceptible people. That seemed to be the right answer. Next, diabetes mellitus cataract वाला. Anybody knows definite answer to that? Diabetes mellitus, cataract, immature senile cataract, phaco and IOL should be done. Don't know. Next was the question on the Graves ka image diya tha with those bulging eyes. What is the diagnosis? I don't know. Was that the option of TSH receptor wala antibodies? There was one option of thyroid receptor antibodies. I don't remember exactly what were the options there in Graves. ये वाला एक ही ऑप्शन था where all the three were given together, isolation, acyclovir and VZIG. वो एक ही ऑप्शन था. Sorry, I cannot remove the color there. Give me a minute. Okay, chalo, going on to the next one. Melanese gangrene wala question tha. I don't know the answer to that. The options were recurrent surgery karo, radical surgery karo within 24 hours if it is recurring. Other option was hyperbaric oxygen does not decrease the mortality. Other option was it is a classical case of Melanese gangrene. And another option was the most common cause is streptococcus, but it can be polymicrobial as well. Okay, so I don't know the answer to that as well. Next, APR abdominoperineal resection in the case of CA rectum, first major vessel ligated, sympathetic with retrograde ejaculation wala option. Don't remember the exact option there. So the red ones I'm putting into controversial. Primary amenorrhea with absent breast hair, but there was inguinal swelling given, which suggested that it is undescended testis wala. So the option of androgen insensitivity seems better. Then it is then the hypergonadotropic hypogonadism. Hyperbaric oxygen वाला था. ठीक है, जाने दो. Next one, fluid deficit increases the risk of. Anybody knows definite answer there? फ्लूइड डेफिसिट इंक्रीजेस द रिस्क ऑफ. एक था जो पॉलीपेक्टमी किया फिर फ्लूइड लॉस हुआ, ऐसा कुछ था. Is it acute tubular necrosis, GIC, pulmonary edema, or thromboembolism? Some options were like that. What do you think is the answer to that one? Quickly. Even I'm in a hurry. So please check for the answer for yourself. Next question was many of you say pulmonary edema, so going with the option of pulmonary edema. Pituitary surgery, now diabetes insipidus. Desmopressin for 1 to 2 weeks or permanent desmopressin? What do we need to do when it's diabetes insipidus post-pituitary surgery? I am confused between ATN and pulmonary edema. I thought fluid deficit kidney को damage कर सकता है, hypoperfusion, so kidney damage हो सकती है. So I thought logically it could be ATN, but I don't know whether it's ATN or pulmonary edema. I don't know the answer to that. Is it lifelong or is it just 1 to 2 weeks? I don't know. Pituitary में, posterior pituitary में तो desmopressin is only stored, right? आ तो ऊपर से रहा है. So that was my thinking there. I don't know what is the answer, right? So check for yourself. Next one. Acne not responding to the treatment retinoin देने के बाद, test for hyperandrogenism. Okay, test for hyperandrogenism. Next one, rotavirus is best detected by antigen in the stool because वो causes stool diarrhea करता है. Child का eye वाला image, what is the answer to that? Fluid deficit patient में है, source of fluid में नहीं है. Was it pinguicula, dermolipoma, dermoid? What was that? Don't know the answer to that. Mendelian inheritance, some students told me the answer is going to be 2/3 of autosomal dominant. Right? It was a very factual based question. Next question was alcoholic patient now with gout. Okay, alcoholic patient now with gout. And what will be there? Will there be high urate, high lactate? Will there be low NADH, NAD ratio? These are the two options where there seemed a confusion. So do let me know what do you think would be the answer to that one. You can check for that. What will be the answer to that one? Okay. And next one. Okay, the last 2 questions. Another question of that ear lobule के सामने swelling है. It will be painful due to anatomic relation to which of the following? It is parotid lymph nodes, facial nerve, investing layer, fascia. These were the options to that. Okay, these were the options to that. And I don't know the answer to that again. And the other one, neck injury, dorsal column, lateral aspect पे injury है. The question asked which of the following will not be seen. Okay, which of the following will not be seen? Which will not be seen? It is not about. It is not कि कौन सा रहेगा. Proprioception, contralateral thigh का क्यों जाना चाहिए? I don't know because the crossing happens in the medulla. So nothing from the contralateral side should go, right? So I believe these are some questions that you should, these are some questions that you can deep dive into it and let me know the answers on the Telegram group. Okay, let me know the answer to the Telegram group. On the Telegram group, Dr. Nikita's Radsynapse. Yes, so those are the 200 questions. I'll share the PDF on the Telegram group, everyone. Okay, so do the recall. Let me know the authentic answers as well with the resources. And then maybe you can get an idea about your score and what do you need to do in future. Whether you need to just have a chill pill or you need to get back for INICD, you will get a clear idea on that. Okay, so that was about this discussion, guys. I hope this helps you estimate your score and get an idea on that. And I believe you should be hunting for the answers because it will help you for the upcoming INICD exam as well. Okay? So which will be seen as nahi tha? Which of these will not be seen was the question. Definitely, that is what I remember. Okay? So thank you so much everyone for joining in. I hope this helps you and do help me get to the authentic answers as well. And yes, keep studying, keep revising and keep winning. Thank you so much and see you again.